What does science say about back pain relief? Back pain is one of the most common medical problems globally, affecting people of all ages and lifestyles. It can result from a variety of causes, including poor posture, muscle strain, herniated discs, arthritis, or underlying medical conditions. Fortunately, science has provided several insights into how back pain can be effectively managed and relieved. Scientific studies emphasize that identifying the root cause of back pain is crucial for effective treatment. Most cases are categorized as nonspecific back pain, meaning there's no clear structural cause like a fracture or infection. In these instances, lifestyle factors such as prolonged sitting, lack of exercise, stress, and poor ergonomics often play a significant role. Exercise and physical activity. One of the most consistent findings in research is that staying active is better than prolonged rest. The American College of Physicians (AACP) recommends exercise as a first-line treatment for chronic low back pain. Activities like walking, swimming, yoga, and stretching can improve flexibility, strengthen core muscles, and reduce the frequency and intensity of pain. Physical therapy guided by a professional is particularly beneficial in targeting specific muscle groups and correcting posture issues. Psychological interventions. Science has shown a strong link between mental health and chronic back pain. Cognitive behavioral therapy (CBT) and mindfulness-based stress reduction (MBS) are increasingly recommended as effective treatments. These therapies help patients manage stress, reduce pain perception, and improve overall quality of life. Research has demonstrated that patients who incorporate psychological strategies often experience better long-term outcomes than those who rely solely on medications and limitations. While over-the-counter medications like ibuprofen and acetaminophen can offer temporary relief, they are not a long-term solution. The ACP and other medical bodies advise caution in the use of opioids, as they carry a risk of dependency and have not shown superior effectiveness compared to non-drug treatments. Muscle relaxants and certain antidepressants may be prescribed in specific cases, but only after other methods have failed. Alternative therapies. Science also supports several non-conventional treatments for back pain. Acupuncture, for example, has shown promise in multiple studies for short-term relief. Chiropractic care and spinal manipulation, when performed by licensed practitioners, can help some patients with mechanical back issues. Massage therapy is another complementary approach that may relieve muscle tension and improve circulation. Lifestyle modifications, weight management, quitting smoking, and maintaining good posture are all scientifically supported strategies to prevent and relieve back pain. Ergonomic adjustments in the workplace, like using supportive chairs or standing desks, are also encouraged. Like, subscribe, follow for your free back pain relief ebook.